There's a spiritual block you cannot see, and it's not inside your willpower. It feels like a fog that arrives the moment you are about to step into clarity. A sudden doubt, a memory that slips away, an inner voice that insists you're not ready. For many people, that fog looks like personal failing. For others, it simply feels like something external pressing against their attention. Today, I want to offer a different possibility. That this blockage is an interference pattern, a deliberate, externalized influence described in extra-canonical Gnostic writings and remembered by bodies more than by books. If this lands with you, I invite you to stay with what you notice. If it resonates, type the single word recognition in the comments, one word only, as a small sign to others that they are not alone. What I'm about to share draws on material found among the Nag Hammadi texts, historical, extra-canonical Gnostic writings, among them a text attributed to the Gospel of Philip. These are not part of the canonical scriptures. They are historical sources that present a different set of images and metaphors for the inner life. They were, in many periods, marginalized or suppressed because they proposed direct access and memory of origin rather than reliance on institutional mediation. That is a historical claim about power and preservation, not a theological judgment. I mention these texts so you know where the language and imagery come from, as guides, not as definitive scripture. At the heart of this teaching is a simple cosmological frame with practical purpose. There is the monada, the primordial source, the origin point of life and awareness. There is, beneath it, the demiurge, a secondary architect who shapes the material arrangement, like a builder who makes a room around a light. And between you and memory of that origin operate patterns the texts call archontes, intelligences, frequencies, or programmed reflexes that distort perception, insert doubt, and maintain separation. Think of them functionally. The monada is the original flame. The demiurge is the builder who raises walls. The archontes are the wiring that controls the lights and locks the doors. Why mention this now? Because the practical claim is simple. Some of what you call resistance, confusion, or sudden disconnection has predictable signatures, traces, in the body. The body remembers what the mind can forget. The older Gnostic language translates into 3 physical markers, 3 points along the body that many people report as subtle variations in texture or sensation. These markers are offered not as clinical diagnoses, but as embodied checks, simple optional ways to test whether the felt fog might be external interference rather than an internal moral failing. Proceed if you are comfortable. If anything causes pain or sharp discomfort, stop and consult a medical professional. These exercises are short and gentle by design. The first mark is at the base of the skull, where the skull meets the neck, the anatomical region often called the occipital base. Place your fingers gently there, not digging, but resting the pads of your fingers at the hollows just beneath the skull. Slide them slowly, with light pressure, along the curve where bone becomes neck. What people frequently report is a subtle texture change, a thin ridge or a sense of a seam. Others report warmth or a slight opening, a small giving that is felt rather than seen. Some feel nothing at all. Hold that attention for a breath or two. Notice if a memory rises, or if a rush of thought arrives to explain away the sensation. Name that thought and let it be. This mark is spoken of as the sign of origin, an embodied hint that your presence is anchored to something primordial. You may feel a quiet clarity, a release of tension at the back of the head, or you may only feel the simple factuality of your fingers on skin. All are valid. No one is required to feel a miracle. After you check the base of the skull, take a moment to sense whether the mind produces immediate commentary. It's nothing. I'm making this up. This is silly. That commentary is itself a data point. It often arrives quickly, with a tone of dismissal. That is a normal reflex in the system. Observe it without arguing. The reflex is part of what the teachings call the archontic interference, patterns that insist on disbelief as a way to keep things small. The second mark is found on the lateral edge of the hand, the outer rim from the base of the little finger down toward the wrist. With your palm relaxed, look at the hand's side as if you are reading a topography. Then, with soft touch, trace a line from the small knuckle toward the wrist, following the natural slope. Some people see or feel a subtle elevation or a fine ridge along that line. Others notice a sensation of slight alignment or an ease in perception when they gently press there. This mark is described as the marker of perception, a bodily confirmation that your senses can be tuned, that how you perceive the world can be changed from within. Again, responses vary. Some report an almost electrical clarity, a sense of edges sharpening in the visual field. Others simply notice warmth or a quieting of the inner noise. If you experience nothing at all, note that too. The absence of feeling is information, not failure. The aim here is not to produce a universal proof, but to provide a means of embodied verification for those whose memories are accessible through somatic cues. If a swelling of doubt or a flood of argument rises when you press that spot, recognize it as another form of interference, the mechanism that replaces seeing with skepticism. The third mark is centered at the sternum, just above the breastbone where the chest feels more hollow, the externum region in some of the older descriptions. Place the pads of your fingers lightly there, above the sternum but below the throat. Do so with care and gentleness. Some people notice a subtle pressure, a rhythmic alignment, or a warmth spreading across the chest. Others describe a brief expansion, as if a shutter opens behind the breastbone and allows a small gust of memory through. This area is associated with command and heart intention, the place where a heartfelt decision can register in the body. For many, pressing here brings a calmness that clears the fog for a breath or two. For others, it is simply the contact of skin and hand. Throughout these checks, remember the safety notes. Never press into pain. Never hold breath until dizzy. Stop if anything feels wrong and seek medical advice if you have concerns. These markers are not universal proofs and are not meant to replace professional assessment. They are, instead, invitations to let the body speak softly and to see whether some portion of your doubt is activated by external patterning. After you have performed the 3 checks, base of the skull, lateral edge of the hand, sternum, there will often be an immediate reaction. It is almost predictable. Voices begin. They might appear as sudden anxiety, as a rush of self-criticism, as the old familiar stories that keep you small. You might feel an urge to dismiss what you've just done, an embarrassed laugh, or an internal panicked thought. This is dangerous. This is wrong. This is just superstition. These are the archontes at work, not metaphors but experienced phenomena that show up as mental reflexes designed to reassert control. When these voices rise, do not fight them. Do not engage in internal debate. Observe their tone and content, then return your attention to the felt sense. Notice whether the criticism is sharp or whiny, commanding or cynical. Name it briefly in your mind. That's doubt or that's fear, and then let it sit. The technique here is simple. Attention without argument. Attention undermines the reflex because the reflex feeds on being entertained. If you watch the voice without feeding it, the voice grows quieter. This is not magic, but practice. A repeated orientation toward the felt center instead of toward the narrative. At this point, many people ask for an activation, a short practice to consolidate whatever recognition has occurred. I will offer a gentle sequence. It is brief, optional, and designed to be safe. If at any point you feel lightheaded, stop. If you have cardiovascular concerns or other medical conditions, consult your clinician before practicing breathwork. Begin with 3 gentle breaths to center. Inhale through the nose to a comfortable depth, not forced, not long. and exhale through the mouth with a soft sigh. Allow the breath to be natural. On the third exhale, place your hand, if comfortable, on one of the places where you felt a subtle mark, the base of the skull, the side of the hand, or the sternum. Choose the place that felt most present to you during the checks. Rest your hand there lightly. Now, aloud, if you are comfortable speaking, say once, clearly with intention, the 9-word declaration: I recognize my origin. I open. I take command. Speak it with calm conviction. The words are not a charm. They are an anchor, a first-person acknowledgement offered to your own system. Say it once, or if you prefer, repeat it 3 times slowly. Each time you speak, listen to the shape of your voice, the way the body responds. Some people report a vibration or a small release in the chest. Others feel a settling of the head. Some report no immediate sensation at all. All outcomes are within normal variation. After the declaration, rest in silence for a moment and notice how your inner weather has shifted. If a rush of doubt arrives, greet it without panic. If warmth spreads, allow it. If nothing changes, that is fine. What matters is the habit of attending to the body as a measure and keeping compassion toward yourself. This ritual is an alignment practice, an anamnesis in miniature, not a guarantee of transformation. Anamnesis in the Gnostic sense means a remembering, the soul's return to recognition of origin. This activation is an invitation to that remembering, not a forced retrieval. Some of you may ask, does this make me special? Does it mean I am a chosen being or that I have power over others? The responsible answer is, no guarantees, no claims of superiority. The language of pneumatic in Gnostic texts describes a kind of orientation towards spirit or remembrance, but it is descriptive rather than prescriptive. Many people, across traditions and cultures, report spontaneous experiences of recall, of a felt aligning with source. Whether any individual identifies with a particular category is not the point. The point is reclaiming access to an inner verification that is not entirely mediated by institutions or external authorities. It's also essential to anticipate a predictable social reaction. When people begin to talk about these types of experiences, institutional structures or familiar friends may respond with discomfort, skepticism, or insistence on orthodox categories. That reaction is historically documented in some of the ways early Gnostic texts were treated. Again, this is a historical observation, not an instruction to rebel or to reject community. Discernment is required. Share responsibly. Be aware that not everyone will understand, and that misunderstanding does not invalidate your experience. If, after this short activation, you feel an unsettling or persistent physical issue, prolonged pain, dizziness, or distress, seek standard medical advice. These practices are gentle and meant to support inner noticing, not to substitute for clinical care. If you have questions about the physiological aspects, bring them to your healthcare provider. Before we close, I want to name the shape of what's at stake. The unseen block is often experienced as internal: shame, unworthiness, distraction. The reframing here is that some of that subjective experience may be sustained by externalized patterns, systems of interference that operate through thought automaticity, through sudden fog, and through the reflexive dismissal of any memory of origin. The 3 marks are tools for verification. The activation is a method to reopen attention to what the body remembers. None of it replaces ethical engagement, personal work, or relational responsibility. None of it exempts you from the hard labor of making compassionate choices in your life. There is also a communal dimension. Memory often returns in fragments, and recognition becomes more stable when witnessed. If you felt any resonance in this practice, you have a choice about what to do with it. You can hold it privately and let it settle. You can share lightly with a friend. Or you can form small circles of practice where people gather to check and to bear witness to one another's experience. If you choose to share in the comments, keep it simple and kind. If you felt something, one short word can help. Recognition. It signals to someone else that they are not alone. Please keep the comments respectful and avoid proselytizing or pressure. In closing, a short benediction, brief and intentional. Speak it aloud if you wish, or hold it as a silent echo. May you find the trace of your origin in the quiet of your body. May the fog lift enough for your attention to remember what it already knew. May the small acts of recognition strengthen you for the work ahead. These words are not a promise of supernatural privilege, but an invitation to a practice, to notice, to name, and to return. If you want to continue this work, subscribe or follow for the next guided activation, where we will explore gentle movement sequences that support these checks and practices for integrating the felt recognition into daily routines. I will offer additional context on the historical sources and careful guidance on safe embodiment practices. Remember, the source material referenced today, texts from the Nag Hammadi collection and teachings associated with the Gospel of Philip, are extra-canonical historical sources that present one stream of spiritual language. Results vary widely. This is not a claim of doctrinal authority, but an invitation to embodied remembering. If you experience any physical pain or unsettling medical symptoms at any time, please stop and consult a medical professional. Spiritual practices are not substitutes for healthcare. If you felt a measure of clarity today, hold it gently. If you felt nothing, be patient with yourself. The work of recognition is often slow and quiet. Thank you for listening. Thank you for caring enough to test the borders of your own attention. We will continue together, with care and with curiosity.